Thank you for listening to Depictions Media Radio.
Hola, muy buenos días, buenas tardes y gracias por conectarse a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas este miércoles 21 de julio. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y como cada semana esta sesión durará alrededor de 1 hora. Ya hemos recibido sus preguntas por correo electrónico y también podrán enviarnos preguntas a través del chat mediante el botón Q y A. Les pedimos siempre incluir su nombre y medio de comunicación al enviarnos las preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, portugués y francés y que pueden optar por cualquiera de ellas a través del botón Interpretation. Hoy la directora de la OPS, la doctora Carissa Etienne, les informará sobre la evolución de la COVID-19 en las Américas, brindará una actualización sobre la vigilancia genómica y las variantes del virus SARS-CoV-2 en la región. Acompañan a la doctora Etienne en la sesión de hoy el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director de emergencias en salud en la OPS, y el doctor Jairo Méndez Rico, asesor en enfermedades virales emergentes en la OPS. Ahora sí, quisiera invitar a la doctora Etienne a que nos comparta su actualización de la situación regional. Doctora Etienne.
Thank you, Sebastian. Good morning, and thank you for joining this week's press briefing. Over the last week, our region reported over 967,000 new cases and 22,000 deaths, a slight decrease from the previous week. More and more disease trends are showing a region divided by vaccine access. In countries with adequate vaccine supply, infections are decreasing in places where vaccine coverage is still low. In those countries, infections remain high. In Costa Rica, where nearly 1 in 3 people are already vaccinated, COVID cases are steadily dropping. South American countries with higher rates of vaccinations like Uruguay, Chile, and Argentina are reporting steep declines in cases. COVID infections are decreasing across Canada and most of the United States. The US states that are reporting increases are the ones with lower vaccination rates, demonstrating the importance of vaccines to control this virus. Unfortunately, across Latin America and the Caribbean, only 15% of people have been fully vaccinated against COVID-19, and several countries like Honduras and Haiti have yet to reach even 1%. And while vaccine donations are on their way to these countries, vaccine coverage remains dangerously low in many more countries across our region. COVID cases are accelerating in most Central American countries, with Guatemala reporting high infections and hospitalizations. Neighboring Honduras is seeing an increase in COVID cases in states along its border. In the Caribbean, COVID cases and deaths are spiking in Cuba, where many provinces are reporting dramatic increases in new infections. The situation is especially acute in the province of Matanzas. Cuba is not the only one. Many smaller islands are also reporting an increase in infections. Over the last week, Martinique has seen a tripling of cases, mainly among young people in their 20s, driven by large gatherings. Worrisome hotspots also persist in Amazonian states in Colombia and Peru. These trends illustrate how COVID-19 remains entrenched within our region, particularly in countries with low vaccination coverage. And the spread of variants only makes matters worse. Viruses have one goal: to multiply. And that's why they often adapt to become less dangerous but more contagious over time. And that's what we're seeing with the SARS-CoV-2 virus that causes COVID-19. Many of today's variants of concern spread more easily, so they're driving new infections in our region and around the world. So far, 47 countries and territories in our region have detected at least one variant of concern, and 11 have detected all four of today's most concerning variants: Alpha, Beta, Gamma, and Delta. New variants will emerge as long as the SARS-CoV-2 virus continues to spread. We face a pandemic of the unvaccinated, and the only way to stop it is to expand vaccination. Vaccines are critical, even if no vaccine is 100% effective. Just as important are the public health measures, like physical distancing, mask wearing, avoiding crowds, and also infection control measures like testing, contact tracing, and quarantine and isolation. Together, these measures are the fundamentals of our response, and they remain effective against variants of concern. Thanks to the efforts of countries across the Americas, our region has built a robust and innovative surveillance network that enables us to keep a close eye on the emergence and spread of COVID-19 variants. The COVID-19 Genomic Surveillance Regional Network was launched in the early days of the pandemic to tackle the eventual arrival of variants. Together, and using science as a common language, countries committed to bolster their laboratory capacity, to hire staff, and to make surveillance a priority, building on the legacy of our region's long-standing dengue and influenza surveillance and laboratory networks. What started as a handful of labs in 2020 has expanded into a robust network of 24 laboratories and growing. This network runs samples from all over the Americas and actively provides information. PAHO has been supporting the network by standardizing laboratory protocols, conducting trainings, and donating supplies for countries that have the technology to test and run samples. In places that haven't yet built up their lab capacity, PAHO has been working to collect samples and to ship these off to network labs. This network has been instrumental in monitoring the virus's spread within border regions and among travelers, who are often the first to introduce variants into a country. By working together, countries can detect new variants faster and more cost-effectively than by working alone. Along with epidemiological data, speed is essential so we can detect changes in the clinical presentation of the disease or its transmission patterns and quickly adjust measures such as vaccination, therapeutics, and diagnosis. Countries can also activate contact tracing and other public health measures to limit the variant circulation. The information gathered by the network is also proving useful for scientists and epidemiologists around the world as they learn how the virus is changing to ensure that our responses remain effective. While the network is focused on COVID-19 surveillance, this platform can just as easily be adapted to identify other viruses and emerging pathogens, so long as our region continues to invest in the training, materials, and human resources that it will take for a network like this to function well. The COVID-19 Genomic Surveillance Regional Network is an example of the power of Pan-Americanism and the importance of working together to control this virus. We must bring the same spirit of collaboration and solidarity to other dimensions of our COVID-19 response, especially vaccines. Our countries stand ready to administer doses as soon as they arrive. And PAHO continues to support member states in their responses, and we remain committed to helping them vaccinate their eligible populations promptly and safely, regardless of who they are and where they live. We urge donors and international agencies around the world to please help our region secure the vaccines that it needs to save lives and to bring this virus under control as soon as possible. But until then, we must continue to protect ourselves and others by using the proven public health measures that can keep us safe from the virus and from all its variants. Thank you so much.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We are going now to move on to questions and answers. As you know, you can send your questions using the chat function and the Q&A button. The first question is by Juan David Rios of Blue Radio from Colombia, and he is asking whether there is already a vaccine delivery schedule by COVAX for this month and also for the distribution in the various countries. Dr. Barbosa, thank you. Yes, there is a schedule, and we are in the process of delivering vaccines through COVAX in July. With the deliveries today, COVAX, through the revolving fund of PAHO, has already delivered about 7 million doses, and this has been delivered, they have been delivered to 9 countries in the region, and we have other 3.7 million doses that will be shipped to the countries by late July. The countries receive a communication from the revolving fund once the date, the flight have been confirmed, as well as the time, so that they are ready to receive them. PAHO is also working with the revolving fund for all of the vaccine donations that are taking place through COVAX may reach the countries as soon as possible. And given all of the limitations of access mentioned by the director, COVAX continues to provide the vaccines to the countries. Thank you. The next question is by Madeleine Davis from the Bureau of Investigative Journalism, and the question is in English.
What are the causes of the oxygen shortages in Mexico and across South America, and what are the solutions? Are you also advising or helping countries to install pressure swing absorption plants in hospitals? Are there challenges with a lack of biomedical engineers or with country regulations, for example? Dr. Ugarte?
Thank you for those questions that are very relevant also for other countries. In the case of Mexico, Mexico has experienced shortages of oxygen in specific areas, like, for example, in Tehuantepec, in the state of Oaxaca, when the number of hospitalizations increased rapidly. The situation in other countries has been the excessive demand of hospitalized patients, and also related with private contracts with companies that provide the service. To meet the new demand, countries are resorting to the use of pressure swing absorption plants in hospitals, but also buying liquid oxygen. PAHO has developed a quick assessment tool to support countries in the identification of the gaps and the best way to address it. In some cases, for example, as the question also mentions, the issues are being to solve through better distribution strategies, while others needs are to install the plants, but also buying oxygen. PAHO and WHO have issued specific specifications for proper procurement and selection of these plants, and also on the oxygen tanks. But again, PAHO tailors the recommendations based on the gaps of each country. In some cases, the issues are related to improving the dosing recommendations, since we found that in many countries, the doses of oxygen is too high, is in excess for treatment. So in some other cases, the properly trained biomedical engineers in oxygen supply has played a role in the speed of addressing the issues and solve the problems. These professionals must be trained in the very specific areas, and PAHO is helping the countries to address these issues, and also doing periodical virtual sessions. And one new course on oxygen supply will be posted in the PAHO virtual campus of public health that will help many countries. A couple of examples, recent examples to show how we are also supporting each country according to the needs. PAHO is now procuring a new pressure swing absorption plant for Paraguay to meet the demand. And in the case of Guyana, PAHO is sending a biomedical engineer to support the needs assessment, directly visiting 30 health facilities across the country and help to make an on-site specific recommendation. So the oxygen supply is a very important issue and has to be addressed according to the needs, both local and national level. Thank you.
Muchas gracias, doctor.
Thank you very much, doctor. We have several questions that have to do with vaccines and the variants. Manuel Colibres from Criterio in Honduras is asking, what is the best vaccine to fight against the Delta variant? Mariana Franco is asking whether some of the vaccines that are used in Latin America that are less effective given the Lambda variant. And Juan Manuel Nievas from the Xinhua media outlet is asking, what is your comment in connection with the effectiveness of the Chinese vaccines, in particular, given the new variants? Dr. Mendez Rico. Thank you very much, Sebastian, and thank you very much for these very important questions. I should mention that based on the current evidence, the vaccines licensed by WHO are effective against all of the variants circulating in Latin America, including variants of concern and variants of interest. Vaccines are not 100% effective. We will always have some cases of individuals that will be infected even if they are completely vaccinated. However, we should also highlight the remarkable impact of vaccines to reduce lethality, and also in the severe cases and hospitalization cases, which are key to control the infection. So regardless of the circulating variants, the vaccines as a whole, given all of the public health measures and new mask wearing, physical distancing, quarantining, case isolation, contact tracing, are the most efficient ways to control transmission. Thank you. Thank you, doctor. The next question is by Gelson Ollave from El Comercio in Peru. And he's saying that in Peru, the Sputnik 5 has just been purchased, but this has not been authorized by WHO. So he's asking, how close is WHO to giving the support to this vaccine? And also he's saying that some countries are not accepting travelers who have been vaccinated with Sinopharm, Sputnik, and other Chinese vaccines. And he is asking whether we think that this could rapidly change. Dr. Barbosa, thank you for the question. Now, in connection with Sputnik, the process has not been completed. And I am referring here to the assessment process for WHO to make a decision on authorizing the vaccine for emergency use. This process in general is a review process of all of the data and also making sure that the vaccine factories meet all of the guidelines and the best practices. For manufacturing vaccines, they also look into trials of phases 1, 2, and 3. So in many cases, such as with the case of Sputnik, more information is requested from the manufacturers, and then the decision is to be made by the manufacturer, and that is to provide all of the information needed to complete the authorization. We do not have a date when this will be completed, and the Sputnik manufacturer has to provide PAHO all of the information for the assessment to come to an end. This is in connection with Sputnik. Now, as to the general efficacy of the vaccines, we are looking into more data that has to do with the efficacy and also with the efficacy of the vaccines in general. WHO is not recommending using vaccination certificates as criteria for travel. This is not part of the international health regulations, and clearly each country may make their own decisions since they are sovereign, but they are decisions at the national level. We always trust that those vaccines that have been authorized for emergency use by WHO, in addition to the trials that showed that they were safe and efficient, we also have efficacy data given the use among the population and given their high efficacy to protect from grave cases, severe cases, and hospitalizations. And this is something that we apply to all of these vaccines. Thank you. The next questions come from Mexico. Andrea Vega from Mexico is saying, what is your diagnosis about the situation in Mexico, where we see a third wave and a great deal of the population is not vaccinated? This is summertime and individuals are crowding on the beaches and in some other areas. What would you recommend, and how do you think this third wave may lead to an increased number of deaths and cases? And also Nuri Martinez from El Sol in Mexico is also asking whether the public health measures need to be corrected given the presence of new variants, and whether the vaccine program should be adjusted given the rejection among youth to get vaccinated. Dr. Ugarte. The number of cases in Mexico, as well as in other countries of the region, is showing a significant increase. Between July 19th and 21st, there were an additional 13,580 new cases, and the general mortality rate is 1,150. So we are in a phase in which cases are increasing. The hospital bed occupancy and also beds with respirators has also increased, and if the number of cases continue to increase, this will also increase. The vaccine coverage in Mexico is about 43% among individuals that are 18 years of age and older, and they are also receiving shipments of additional vaccines. Therefore, vaccination shall continue. 43% of that vaccinated population includes the higher risk population, so we are expecting to maintain the mortality rate with this new case increase. As a matter of fact, vaccination has made great progress, and we hope to attain higher coverage. But in the meantime, it will be very important during this summer season and with the reopening of the activities for the population to continue to adopt protection measures, in particular when physical distancing is more difficult. Therefore, this is a challenge because on the one hand, vaccination is making progress. This conveys a sense of safety and security, and all of us want to leave this pandemic behind. But we have seen time and again that whenever we let our guard down, the number of cases increases significantly. So this is a responsibility shared by health authorities, as well as political authorities in the country. And we hope that this case increase can be controlled in connection with the work of the health services that still have the ability to respond. And so we hope for this reopening not to have a greater impact. Thank you. Thank you, Doctor. The next question is by Tanya Smith Cartwright from Tribune in Bahamas, and in English it reads,
any COVID-19 variants present in the Bahamas, in particular the Delta variant that may be causing an uptick in our infection numbers? Dr. Jairo Mendez Rico.
Thank you very much for that question. In close collaboration with the Genomic Surveillance Regional Network, several samples from the Bahamas have been sent to the sequencing reference lab in Fiocruz, Rio de Janeiro, in Brazil, where actually complete genomes have been obtained. According to the most recent information to be officially verified by the country, but already available in global databases, the Alpha variant of concern has been detected in most of the samples, together with other variants in less proportion, including the Iota, which has been classified by WHO as a variant of interest. So far, there is no evidence of Delta variant circulation in the Bahamas. Nevertheless, the genomic surveillance should be maintained to timely detect the possible introduction and spread of Delta or any other variant. Thank you very much.
Gracias, doctor. La siguiente pregunta llegó.
Thank you, doctor. Next question is from Daniel Polite from the New York Times. It's in English.
Could you please give us an update on the vaccination campaign in Haiti now that it has started to receive vaccines? Dr. Etienne?
Thank you, Daniel, for this question on Haiti. Haiti began vaccinating health workers and vulnerable people less than 48 hours after 500,000 doses of Moderna COVID-19 vaccines donated by the United States through the COVAX mechanisms arrived in the country. And this underscores our boast that our countries are ready to administer vaccines as soon as they arrive. The Ministry of Public Health and Population started vaccinations last Friday at the Hôpital Universitaire de PAHO in Port-au-Prince. And vaccines are now also available for health workers and elderly people at the Hospital Saint-Damien and at the GESCO IMIS facility. The country plans to expand availability throughout the West Province and then to the rest of Haiti as more vaccines become available. And information on vaccine availability has been prepared in French and Creole with details on the places, the times, and the eligibility for vaccines. We know that communication to the public is a key element in any vaccination campaign. And people need to be informed about the benefits of the vaccines as well. While we, of course, welcome the arrival of the vaccines and the start of the country's COVID-19 vaccination program, there are many technical and operational challenges ahead to ensure that shots get into the arms of the people that need them the most. So this means we need to promote vaccination. It means educating the population about the huge benefits of vaccines. It also requires preparing healthcare workers and, of course, ensuring that public health measures continue, even while the country awaits the arrival of further vaccines. PAHO will continue to support Haiti with our partners to ensure that they receive and distribute the COVID-19 vaccines that are available now, and certainly those that will become available in the near future. Thank you so much.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne. Another question from Daniel Politi from New York Times in English.
On the situation in Cuba, have you seen an effect on the spread of COVID and or the vaccination campaign following the widespread protest? Dr. Ugarte?
Thank you for those questions. Well, the number of cases in Cuba have been increasing before the recent protests and manifestations. And Cuba is currently seeing the highest number of confirmed cases of COVID-19 in the entire country. more than 43,000 cases were reported, and that's an increase of 21% of the last epidemiologic week, the 28th of this year, and an average of 6,199 cases per day. So that is a worrisome situation. The national authorities also have confirmed the circulation of the Delta variant in several provinces of the country, and its higher transmissibility is as a source of concern. And there are inside the houses, the families have been transmitted with the disease. So this is also another issue, and also younger people. We saw that the provinces that have more cases are Matanzas, Ciego de Ávila, Cienfuegos, Guantánamo, Mayabeque, Santiago de Cuba, Villa Clara, and Sancti Spiritus, all with figures above 500. So we are seeing that the incidence of the COVID-19 in Cuba is still at the highest level. At the close of 17th of July, more than 3.3 million people in Cuba had received at least one doses of the vaccine candidates of the Abdala vaccine. So that is approximately 30% of the population. So it is still at the low level of receiving this vaccine candidate. And we need to recognize that every measure, public health and social measures, are needed to be implemented at all times, particularly when the transmission is very active, as in the case of Cuba. Thank you.
Gracias, doctor. En el chat.
Thank you, doctor. On the chat, we have Wilson from NPR News.
Is trying to send vaccines to countries in PAHO and around the world, but it is encountering major logistical problems in getting these doses into countries. What does PAHO see as the biggest challenge? What can be done to expedite these deliveries? Dr. Barbosa?
Thank you for this question. I think that this is very important, first to recognize and to acknowledge the donation from many countries. Logistics is always a challenge because we have had many disruptions in the logistic chain in the region and in the world, but PAHO is working very closely with the U.S. government. Let's remember that our revolving fund has been delivering vaccines through all countries in the region for at least the last 40 years. So we are working with the U.S. government. We have already delivered vaccines through our revolving fund that were donated by the U.S. government. We delivered these vaccines to El Salvador, to Bolivia, to Honduras, and others will come. So the logistics is a challenge, but I think that working together and including counting with the support from some private companies that are also offering to have room in their flights, I do believe that we will get these vaccines as soon as possible in the countries to have the people vaccinated. Thank you.
Gracias, doctor. La próxima
Thank you,
pregunta.
doctor. The next question is from Lidia Lopez from La Prensa of Nicaragua. What is the situation of the Delta variant in the Central American region? And another question is, how is the process to detect variants of COVID-19 progressing in Nicaragua? And also Giovanni German, also from La Prensa Nicaragua, asked the same question. And there are other journalists on the chat asking the same question. Dr. Mendez Rico. Thank you very much for your questions. As part of the technical cooperation projects, PAHO has sent inputs and reagents for screening and detecting variants of concern not only in Nicaragua, but also in 23 countries and territories in the region. At this point in time, we don't have information about detection of variants of concern or interest in Nicaragua. Also, let me say that thanks to the efforts of Guatemala, Honduras, El Salvador, Costa Rica, Panama, and the very close collaboration with the regional genomic surveillance network of PAHO, we have been able to demonstrate the alpha and gamma circulation and which are co-circulating with iota and lambda. According to the data, the Delta variant has only been demonstrated recently in Costa Rica. Sustained surveillance will allow us to detect in a timely basis the appearance of Delta in other countries and be able to follow up to see about its possible dissemination. Thank you. Thank you very much. Next question on Nicaragua from Kaylin Romero from the Confidencial Nicaragua. What has happened with the dispatches of dispatches of vaccine to Nicaragua? Is there any estimated date? And does PAHO have information about increase of contagion and transmission of COVID in Nicaragua, mainly among the healthcare workers? Dr. Ugarte. Yes, thank you. There are several orders in process right now, and the estimated dates are between July and August. Some of them in the next few weeks, they would arrive through COVAX, and the donations from Spain, 97 doses, has no set date yet, but it's estimated that in August, and 134,000 doses would arrive at the end of August, beginning of September as well. So there are additional vaccines that are being processed and will be arriving in Nicaragua soon. Regarding transmission and unfortunately, we do not have enough information regarding the situation, the epidemiological situation in Nicaragua, given that the information that we receive is very stark, and it's the information that is published through media and through the IHR, but this data is not disaggregated, so we don't know how many people from the health workers or the locations and times, and disaggregation by age, gender, etc. in the Nicaraguan territory, and as my colleague Jairo Mendez said, also related to the presence of variants. So there is no disaggregation of these data. So this is what I can report right now. Thank you, Doctor. Next question is Kadim Joseph from the Observer Media in Antigua and Barbuda in English.
Antigua and Barbuda and several other countries in the region are still having issues with voluntary vaccinations. So much so that the government is now considering mandating COVID tests twice per month at the personal expense of some categories of workers, coupled with inducements. Is there a best practice to overcome this hurdle of hesitance? Dr. Barbosa?
Thank you for this question. I think this is a very important challenge that all the countries are facing now, because even countries that started the vaccinating in January or December are still struggling to convince people to get vaccinated. It looks like it's not, we cannot believe, but unfortunately there are many people that have doubts about the vaccine, they have hesitancy to get the vaccination. Of course, that each country has its national laws and regulations. In some countries, vaccine is only on voluntary basis. In other countries, they have some regulations that can mandate vaccines. It's up to the countries. But it's very important now is how to reach out the population with clear messages about the vaccines. Unfortunately, vaccines against COVID-19 were targeted by many conspiracy theory groups, anti-vax groups. People are disseminating many things that are not true. First, these vaccines cannot change your DNA. Second, these vaccines are not inexperienced process. They are vaccines that have been developed for many years for other viruses, and they are using platforms that are very well known. And third, these vaccines, performed the whole process to be approved to human use. So they needed to prove that they are safe and that they are efficacious. So it's very important, and PAHO is working with the Caribbean countries and the countries in Latin America to how to send the correct messages to healthcare workers, to the communities, because it's very important to show the reality of the people. If the vaccine is available and you don't get the vaccine, you are not only putting yourself at risk, but you are also contributing to delay the control of the transmission. So it is also harming the community, the country where you live. So it's very important to establish this clear communication, to provide all the information to have people getting the vaccine that they need. Thank you.
Gracias, doctor. La próxima pregunta
Thank you, Doctor. Next question from Matias Loelvi from Midscape in Spanish, and it says, on other occasions, WHO and PAHO were against health passports. The apparent success of measures adopted by France and the threat of the expansion of the Delta variant, would this lead to changing your position in this area? Dr. Ugarte, yes, thank you very much. It's a very current question talking about economic opening. There are many international trips that are beginning again in many countries. So it's a very current question, I repeat. I would like to say that in the most recent recommendation or report by the Emergency Committee of WHO, through the IHR regarding COVID-19, the Emergency Committee says that the health passport or a vaccine proof should not be demanded as the single proof of vaccination. And this is what we've said in PAHO from the beginning. It's necessary to have a series of measures to be able to reduce the possibility of transmission, considering that it is impossible to reduce it to zero. This means that if international travel is reopened, for example, for people coming from countries where vaccination is very high and where transmission of COVID-19 is very low, then it's likely that in those cases the risk will decrease. But as we've seen in many countries where they have executed those measures, unfortunately, they've seen new cases, especially from the Delta variant, which were not detected in origin or when they arrived in the other country. So we need to constantly be doing a risk analysis, and the testing period for negative tests, either by PCR or the vaccination proof or the origin of countries that are of low transmission. All these are measures that need to be taken into consideration by countries when deciding whether to reopen international travel. And at the same time, they continue to implement measures inside the countries. It's very important to monitor the situation of health services, do active detection of cases, isolation of suspect cases, quarantine of contacts. And these continue to be the same measures that have yielded very good results, and they should continue to be used and into the future. Thank you so much. Thank you, Doctor. Next question on the chat comes from Chris Vilches from Zona Lima, from El Comercio in Peru. And it says the indicators of the pandemic in Peru show a decrease in contagion and deaths due to coronavirus. Only 16% of the population has received the 2 doses of the vaccine. In this scenario, the non-vaccinated people, either because they don't want to or because it's not their turn yet, do they represent a possible third wave risk? Dr. Barbosa, thank you very much for your question. Yes, of course, it's important to work with the 2 measures that we know can lead to controlling transmission and preventing new waves. First, expand vaccination. Yes, of course, there are in Peru still people who need to receive information about vaccines so that they trust it. It's very important to listen to the doubts that people have, to respond to them, seek support from specialists that can talk accurately, the doctors, nurses, those who can convince people of the importance of getting vaccinated. At the same time, it's important to maintain public health measures adapted to each situation using masks, avoid crowds. These and other public health measures have proved to be very effective to control transmission. They have been proven to be good in Latin America, the Caribbean, Europe, North America, etc. They can be extremely effective. So up until the point when we can control transmission, it'll take several months still. It's important to broaden vaccination. And if people are still hesitant, it's good to seek a dialogue, seek information so that those who can have access to it get vaccinated and also follow protection measures. Countries who have had significant vaccine coverage still have peaks in transmission. So it's not enough to have just a certain amount of vaccine coverage. We still need to keep the public health measures, which we know work. Thank you. Thank you very much, Doctor. We have some other questions about Venezuela. Mariana Soquet from Efecto Cocuyo asks, can Venezuela receive vaccines through the COVAX mechanism already? How are discussions underway? And when will the country, or has the country decided what vaccines it will get through COVAX? And Luis Carlos Parada asked about the variants. How many variants are circulating in Venezuela currently? And do we have information in this regard? Dr. Ugarte, maybe you could start. Thank you very much. Yes. Well, Venezuela, as all of you know, changed its agreement modality with COVAX. And in this new modality, they'll decide what vaccines they accept among those that are available through COVAX. These discussions will take place soon, and we will then know what vaccine and how many doses will be arriving in Venezuela. Meanwhile, preparations are being made in order to be able to implement the vaccination schemes. PAHO is working with many partners to carry out vaccination, of course, working with the public health ministry and the health network. And so that when the vaccines finally arrive, they will be applied and administered in the priority populations. The training and logistics in order to implement vaccination are aspects that are underway in an expedited way, and also through additional resources that will be arriving not only to implement vaccination, but also with some donations of vaccines. There would also be a larger number of vaccines being received from the donations. I don't know if Haido has something to add regarding variants or other things. Yes, thank you very much. In fact, regarding surveillance, in Venezuela, thanks to collaboration and well-coordinated work between the Venezuelan Institute of Scientific Research and other research institutes, there has been work to demonstrate the circulation of different variants, which was expected, including the alpha and even more so gamma. These are two variants of interest in the region. Other variants, I'm sure, will be detected in the process that is growing in terms of surveillance, genomic surveillance in this country. Now, from Cairo, Suriname says,
some countries don't allow persons who have been vaccinated with the AstraZeneca vaccine produced in a particular country to enter their territory. Is there a quality difference with the AstraZeneca vaccine related to the country where it was produced? Is the one more effective than the other? Dr. Barbosa, ¿podría contestar?
Yes, thank you for this question. Now we have a different situation in the world related to the production of vaccines. Some producers, they have more than one sites that they can produce vaccine. AstraZeneca, for instance, it has around 12 sites that are producing the vaccine. The vaccine is the same, but the emergency use listing authorization from WHO is made site by site. So, for instance, if one site does not want to sell vaccines to the COVAX mechanism, probably they will not apply to receive the EUL authorization from WHO. This does not mean that this vaccine has more or less quality than others, but we only can confirm the quality when the process is completed and that the specific site was reviewed and approved to receive the EUL authorization from WHO. Some countries, they are using a criteria that, and I think that probably the journalists wanted to mention the production of AstraZeneca that is made in India. Now, in India, the production in India is authorized by WHO, has the EUL authorization, but the Serum Institute of India, that is the producer, has, at least so far, hasn't yet applied to receive the authorization in Europe from the European Medical Agency, probably because they don't want or they don't have vaccines to sell to European countries now. So this does not mean that this vaccine has less quality. Vaccines that receive the emergency use listing authorization from WHO were reviewed by a panel. All the documents were provided, all the information were provided, and they have similar quality. They have all the same standards of safety and the efficacy. So if this vaccine has the EUL listing authorization, we know the process, we know the site that is producing, and we can ensure that this is a quality vaccine. Thank you.
Gracias, doctor. Siguiente pregunta en el chat es de Carolina.
Thank you, doctor. Next question is from Carolina Mesa from Primicias, Ecuador. What is the effect that the Delta variant is causing in the development of the pandemic in Latin America? And so she wants an explanation on the B1621 variant detected for the first time in Colombia. What are their characteristics and where has it been detected, and has it been considered a variant of interest? Dr. Mendez Rico. Yes, thank you very much for your question. These are important questions indeed. Yes, the Delta variant has been detected in our region in at least 18 countries. To this point, it has been limited to cases of travelers, and community transmission continues to be limited in some countries, whereas there are other variants that predominate. It's perhaps too early to say what the real impact is going to be of the Delta variant in our region. If we consider other variants like Alpha, with a high capacity of transmission, they just predominated on a transient basis in some countries, and they were rapidly replaced by others like the Gamma or the Lambda variants. So we need to continue to surveil the transmission and the behavior of this variant. It's too early to say what the actual effect of it will be. Now, regarding the B1621 variant detected first in Colombia, In fact, this variant has not been classified as a variant of interest because it does not comply with the epidemiologic profile required, including a proven capacity to transmit the virus in a very high rate or having some deleterious effect. To this point, this variant has been detected in some of the countries in the region. It has been detected also in Europe. However, I insist, here in our region, it has not predominated. It's not the predominant variant in Colombia. It co-circulates with other variants, with different other concern variants. But to this point, we don't have any evidence to indicate that there will be an additional risk from it. It's been closely surveilled, and when there is evidence, we will share it and we will report it. Thank you very much. Thank you, Doctor. And we're coming to the end of our press briefing today. We have some questions related to vaccination donations. And the question in English is,
and what do you think about the surplus COVID-19 vaccine doses in some countries, like the US, that are approaching expiration dates? Dr. Etienne?
So thank you for this question. In Latin America and the Caribbean, around 15% of the population has been fully vaccinated, and more vaccines are urgently needed to control this pandemic. But this overall figure hides the large disparities in our region. In some countries, only about 1% of the population has been vaccinated. So we clearly need more vaccines, and we need them now. So at this time, vaccine donations are really the only way for many countries in our region to secure the doses that they need quickly. The US government has pledged to donate some 12 million doses of COVID-19 vaccines to countries in Latin America and the Caribbean, and we are really thankful for these donations. And part of this pledge, comprising some 4.5 million doses, have already been delivered to Honduras, El Salvador, Bolivia, and Haiti. And PAHO is also working with other countries from around the world to get more vaccines for Latin America and the Caribbean, where I think they are most needed. We expect to receive more vaccines and support for vaccination efforts from the United States, the government of Spain, and the government of Canada. Other countries, including France, have also expressed their willingness to support our efforts. And PAHO's revolving fund is facilitating the logistics and other important aspects for these vaccines to arrive promptly and safely in the case of those that are being distributed through COVAX. Other vaccines are reaching countries directly through bilateral donations as well. And Spain has pledged to deliver some 750,000 doses, and we hope that other countries will follow. We want to commend all countries for sharing vaccines with our region, but the truth is that we need more. Please don't wait until you have surplus doses. You need to share out of what you have now. Some countries have reported that millions of undeployed doses might be expiring soon. The logistics of vaccination, getting them into people's hands, is really complicated. But as I have said, our countries have the expertise and the experience to do this efficiently. And that's one of the reasons that we are asking countries with vaccines to donate them to the Americas, where they are most needed. Without vaccines, we risk more people getting sick and more lives being lost. And we need countries to share these vaccines more rapidly so that together we can save lives. Vaccines are not a privilege for the few. They are the right of everybody. Vaccinating as many people as possible and as rapidly as possible is in the best interest of the whole world. So we are telling countries, please do not wait. Donate vaccines now to PAHO and COVAX. Thank you, and thanks again for joining us today.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos
Thank
llegado.
you, Dr. Etienne. We have come to the end of this briefing session today. Remember that you
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.